I'm going to introduce Barbara Mandel and want to say we are very happy that you have joined us today. Barbara has facilitated the Alzheimer's Project Clinical Roundtable for Champions for Health since 2014, and that's a philanthropic organization of the San Diego County Medical Society. She served as the organization's CEO from 2011 to 2018, and under her leadership, that organization has expanded to scope in community health and education, including the launch of the Live Well Physicians Speakers Bureau, also increasing public awareness of the incidence of prediabetes and prevention strategies. She's done many other things as well. She has more than 30 years experience in healthcare field. And prior to joining the Champions for Health, she served as the funder collaborative consultant for San Diego grant makers, facilitating collaborative philanthropy around 4 healthcare issues facing the San Diego community. One of the funder collaborations was focused on homelessness, and that resulted in the development of a regional plan to address and end family homelessness. And Barbara authored that initiative. She's also served as Executive Director of Partners for Community Access and Community Outreach Director for Palomar Health. Both of these roles focused on improving health outcomes of North County residents. As a healthcare consultant, throughout her career, she's worked with most of the healthcare systems in the community, including Scripps Health, Rady Children's Hospital and Health Center, and Sharp Healthcare, as well as several disease-focused nonprofit organizations. It's a lot of organizations. She holds a master's degree of business administration and healthcare administration from California State University, San Marcos, and UC San Diego, and a bachelor's of science in advertising and public relations from the University of Illinois School of Communications. So with that, I will turn it over to you, Barbara. And again, thanks for being here.
Oh, thank you for having me. And Dr. Galasco, so nice that you're on. I am going to share my screen and let you know what we've all been doing. Okay, so I'm going to be just kind of giving you an update of what we've been doing on the crisis on Alzheimer's disease and related dementia and the role of the Alzheimer's Clinical Roundtable. And some of these statistics, of course, you know so well. So first of all, you know that Alzheimer's disease has been, in the last 2 years, the 4th leading cause of death. It had been the 3rd leading cause, but fortunately, COVID beat us out. And it's projected to increase substantially in the next 10 years. And this is a slide that just shows where individuals with Alzheimer's disease tend to live in our county. So we're seeing huge concentrations in East County, in South Bay, and of course in central San Diego area. No surprise to you. We also, when we talk to healthcare leaders, we try to explain to them about, why is Alzheimer's disease so important? And much of it is based on the projected community costs. The political leaders around the county are very interested in the numbers and the dollars and cents and so forth. So we use these projections that came from the county as well as from the Alzheimer's Association's national study about how much is spent on informal caregiving, on hospitalizations, and on caregiver healthcare. And you've seen these numbers just growing rapidly. For those not as familiar with what the Alzheimer's Project has been, it was begun in 2014 under the county supervisor leadership of Diane Jacob, who had a personal connection. And initially, they organized what they call three roundtables. One is Collaboration for Cure, that you're probably most familiar with, in which private money was raised for early studies, early biological studies that would potentially lead to other opportunities and further study. And so I think there were 5 studies that were funded, and of those 5, 3 of them went to the next stage. The other was a care roundtable was organized, and it included a number of members from the care communities, including Alzheimer's San Diego, which at the time was the Alzheimer's Association, and then the Alzheimer's Association, Southern Caregiver Resource Center, Glenner Center, JFS, and a few others. That care roundtable is not in effect in that same formation, but there is a lot of emphasis on the caregivers that is continuing throughout the community and under the auspices of Aging and Independence Services at the county. And then Alzheimer's San Diego, which was the new name, when the transformation happened, took on a major role in terms of public awareness and education, and they were funded to do that. And somewhere in the middle of 2014, because 2 people, Dr. Bill Mobley and Dr. Michael Lobatz, were both involved in the Alzheimer's Project leadership team. It was like the light bulb went on. Gee, we forgot to talk about the doctors. So the county came to us, to Champions for Health, because we'd worked with them on a lot of other projects, and said, you're uniquely situated to convene physicians, and can you help us? We need to organize a clinical roundtable and get physicians together to talk about what needs to be done next. So we said, yes, we'd be delighted to. And so it was initially co-chaired by Dr. Lobatz and Dr. Nick Efantides, who at the time was the county medical director. We first got together, and Dr. Glasgow was at the very first meeting, and he can probably attest to the fact that, the doctors started talking about, like, what can we do and how should we do this? And so we started meeting regularly, and we started looking at some of the numbers, and it was very clear that with the number of, and in 2015, the number of family practice internal medicine physicians compared to the number of geriatricians and neurologists and psychiatrists, it was very clear immediately that there was no way that the specialists were going to be able to adequately screen, diagnose, and manage the patients who were increasingly being affected by memory issues. And so the group decided that what they needed to focus on was providing resources and training to the primary care physicians in San Diego County on how to do this and equip them for what the future was going to hold. And so we know this was based on the Alzheimer's Association's statistics. We know that while individuals 50 plus, 55 plus receive a lot of other screenings at the time, the number of people, it was only 16% of individuals considered to be seniors were receiving any screening on problems with memory or thinking. And to compound it even more, out of the huge number, 93% of older individuals were visiting their PCP, and yet less than 30% had received a cognitive screening. We also learned that the caregiver stress is a huge issue for individuals. And you probably, by the time patients come to you and they're in a clinical trial or they're participating in your wonderful support groups, the caregiver stress is a considerable consideration. So the clinical roundtable is focused and has been focused on, first of all, the development of standards of care. for screening, evaluation, and diagnosis of Alzheimer's disease and related dementias. And interestingly, when we started surveying the variety of health systems in San Diego County, we heard all different kinds of stories, even from within the same system. So for instance, UCSD, there were some physicians that were not screening at all. They were just, somebody made a complaint, they were just referring them to neurology. Others were using a MOCA or an MMSE test. Some were using what we've decided is the preferred, which is the mini cog, which takes 3 minutes compared to a 45-minute appointment. So, and still within the health systems, despite our best efforts, we're still seeing a lot of diversity in how individuals are handled or cared for, screened, and so forth. Then from there, we wanted to develop guidelines for the management of symptoms and issues, and provide education to the primary care providers, identify resources for physician staff and family caregivers. What we learned was that the number one thing that physicians said they didn't have was they had no idea what kind of resources there were available. And many physicians didn't even want to diagnose because they felt like, what was the point? There wasn't anything really to provide the patient. And they didn't even know, they were unaware of any resources that were available to caregivers. And then our last focal point, which is something that we've been working on in the last 2 years particularly, has been the systemic adoption of these standards and best practices throughout San Diego County. So what we call the Clinical Roundtable 1.0 and 2.0 was the period between 2014 and 2019, also called the pre-COVID period, because things changed dramatically. So as I mentioned, we began our efforts in November of 2014. The first clinical guidelines were created and published in 2016. Dr. Glasgow was a huge help in all of our editions, but that first one really was a lot of work. If you can imagine, which I know you can, physicians spending 2 years figuring out how to agree on standards of care. So that was really terrific. And then after that was published, we immediately started thinking about what changes were needed and how to accomplish that. And so they were revised in 2018 and published again. And during that time period, there were over 2,800 physicians, including residents, that were trained on the clinical guidelines. And we were, because the county loves counting, we counted 8,500 viewers to the website where, and I'll show you a picture of it later, where we keep all the resources available and update that website on a monthly basis. We also developed a mobile app. The doctor said, gee, it would be really great if, rather than being behind a screen behind their electronic medical record, if physicians could be more eyeball to eyeball with their patients, and from the convenience of a mobile phone, they could just very simply be asking the questions and doing the screenings, and so that they could maintain that eyeball contact. So we created, it's called ALZDXRX. It is available for free. And we'll talk a little bit later about some of the challenges. But initially, we had 450 physicians that were utilizing the app. Then we started sending out newsletters, usually, to all of the primary care physicians, and with any information and updates, trying to draw them to the website. We distributed 1,500 physical copies of the first 2 editions of the guidelines. And then we also had a number of online downloads. Unfortunately, we weren't able to count the number of downloads. And then over the period of time, we created some exam room posters in English and Spanish and distributed those to every primary care provider, including the community clinics, which encouraged people to start talking to their physician about screening. We didn't want to do that too early because we wanted to make sure that a number of physicians, the majority of physicians, had training at some level before we start encouraging a lot of questions for them. And then we conducted a very small pilot study at 2 clinic sites at Scripps Clinic. And we wanted to see what would happen if at one clinic we gave the clinicians more intensive training on screening, particularly on screening, and what was going to be the result. And so what we found was that we had very positive results. First of all, the number of people that actually received a screening increased by 30%. And additionally, they had in their medical records now, they had a much more distinct diagnosis rather than just memory loss issue. There was a diagnosis in there. And then Kaiser began to roll out adoption throughout their system. They noted that they were getting inundated. The neurologists were saying there was like an 8-month backlog on appointments. And so the neurology department had a change in leadership and basically decided that they were not going to allow referrals for screening any longer, and that the primary care providers were going to have to do the screening. As it turned out, that didn't quite work the way they originally thought. So now they use a model where patients who have a memory loss issue are referred to neurology, but the screening is actually done by a primary care provider, nurse practitioner. And so that person does all the screening and then coordinates the care process with them. And they have a very different system than UCSD does. But we all thought, let's see what's going to happen when neurology says, I'm not taking any of those patients unless they've been screened. So it was kind of interesting to watch. And through this process, physicians donated over 1,600 hours to this project. So then there was COVID. And as we all know, screening dropped considerably because patients were not coming in for regular appointments. They were doing some virtual appointments if it was necessary, but things really, really slowed down. We were actually not funded for the first 9.5 months of 2020. Our funding from the county had run out to do this work, and they kept telling us, don't do anything because we're going to refund you soon. And we are now being funded through June of 2022, which is coming up in just a few months, through the statewide Healthy Brain Initiative. And with the Healthy Brain Initiative, while we are continuing the work that we've been doing, we've also added a number of other pieces to that, including working with primary care providers on some prevention strategies for patients who have other but related issues, such as high cholesterol, high blood pressure, diabetes, obesity, et cetera. So during the 2020 to 2022 period, and under the Healthy Brain Initiative, we have 4 committees. One is the Guidelines Review Committee, which has completed their work. And the Physician Education Committee works on a regular basis to develop presentation content and to deliver content to providers. The Patient and Caregiver Support Committee worked very hard with the guidelines, developed some new materials, including that brain health tool, and their work has been completed. And then the 4th, which is really the most active at this moment, is the Guidelines Adoption Committee, which is a group of influencers, which we are still recruiting for, of primary care providers that will, at their own health system, lead towards the adoption of system standards of care. So during this time period, we did publish the Clinical Guidelines Edition 3, and we created the Healthy Brain Tools in 5 different languages. And we created new exam room posters in 5 languages. And then what I forgot to mention before was we had created some CME webinars, 1 hour webinars broken into usually 4 segments, 15 minutes each, that provide PRA, AMA level 1 CMEs for providers through our association with the Doctors Company, which is the largest healthcare malpractice insurer in the country. And they're provided for clinicians free of charge, and really take you through screening, evaluation, behavioral management, pharmacological use, pharmacotherapy, pharmacological management of behavioral symptoms, as well as pharmacotherapy, which is really focused on, should we be using cholinesterase inhibitors and memantine, or should we not? What do we do about aducanumab or not? And those kinds of issues. And then we also created one that's like a question and answer with a group of physicians that talk about the most common issues that physicians face. Then we also created an on-demand webinar on aducanumab because it was so controversial when all the news came out. It's still very controversial, as you know. We updated the mobile app with caregiver screening because now the focus was also going to be on how do we screen our caregivers for stress and burden, so that we're not creating mental health issues and physical health issues for our caregivers as well. And then we continued with our clinical education. Now we were tasked to provide education in screening and evaluation, care planning through the stages of disease, and on caregiver education and support that includes the screening of caregivers. So we've been proceeding on that. So to give you a glimpse of what a healthy brain tool looks like, it's basically a very short, because nobody reads anymore, handout that is electronically attached to the after visit summary and gives people who may be at risk for other health issues some very quick tips on how to improve their health. And these have been shown to be, this was from the CDC. This material wasn't from the CDC, but the research behind it and what the main issues should be, what came from the CDC research. And then this gives you a glimpse of what the website looks like currently. And we get, hundreds of hits every month on that, which is great. It's got all kinds of tools on it. All the instruments are there. So if a physician doesn't have a booklet handy or whatever, they can just download whatever instruments they want. And then this is what the mobile app looks like. And any practitioner can use it. It doesn't have to, the NPI number just indicates that it's a unique number, so the individual signs in to use it. And then can take a patient through a variety of instruments. And then at the conclusion of doing each instrument, there's a score, and that score can be emailed to the provider's email address so that it can be uploaded into the medical record. We have not been able to get EMR integration yet. However, and the other thing that's been a challenge has been that while physicians might enjoy using the tool from the comfort and convenience of their phone, the health systems don't share that. And some of the health systems are saying to their providers, we do not want you using it. We want you using your electronic medical record, and you'll put your scores in there. So we're trying to bridge all of the gaps there. And our next thing we're trying to accomplish is to figure out how it can be integrated into, or at least the instruments can be integrated into the Epic EMR in a way that makes it as easy as possible for providers. So But it was designed so that it would just walk providers through the whole process. And so that continues to be a challenge. So you might ask, you know, how does this affect the work that you're doing? As I mentioned, UCSD does not right now really have a standard protocol, and we're working on that, and we'll hopefully be doing another clinical study with UCSD clinics to prove how much more time effective it is to have standardized. For instance, providers who are still using a MOCA or SLUMS for screening may be spending 45 minutes with a patient when they could be doing a mini cog in 3 minutes. And so that's part of the standard protocol. The standard algorithm is you start with a mini cog and an 88 and a PHQ-2. And then, you know, if there's a failure there, you move to the next step and so forth. It's a very easy to follow decision tree kind of a process. So, so we're hoping that in the next, let's just say 12 months, that we're really able to move forward with that. We are working with the folks in the EPIC group to make sure, and thanks to Dr. Galasco as well for pushing on this, to make sure that all of the instruments that we're recommending all have smart phrases, and hopefully there will be distinct fields in EPIC for them to use. To put the scores in so that you could actually look at the data and say, gee, this number of people actually received a screen, because right now they can't. And right now what you can look at is you could see how many people in a clinic, for instance, have a current diagnosis. But as we know, there's not enough people being screened. So what standardizing and adopting the guidelines can do is, first of all, being able to diagnose patients earlier with more definitive diagnosis would be really helpful. And that would result, hopefully, in more candidates for trials through the ADRC. Physicians will be better equipped to care for their patients through the stages of the disease, so there'd be less need to refer patients for neurology or psychiatry unless they fit that criteria, you know, early onset, a number of other what we consider to be red flags that would say, gee, that person really needs to be seen by a specialist because it's probably not Alzheimer's disease. It could be one of another less frequent dementias, or it could be another issue. We also really try to focus with the physicians on looking for reversible conditions and things that might look like dementia, but are really more biological in nature. So we're hopeful that, you know, through our long partnership with the ADRC, that we can help. And, you know, I'm very open to learning from you what more the clinical roundtable can do to support the efforts in our mutual pursuit of caring for those who are experiencing dementia. Our website is updated regularly with all kinds of new information and resources. The resource pages for caregivers are very important for providers because, as I mentioned, they said that they really didn't know what the resources were. So we've got a pretty exhaustive list of resources that are available on the website for downloads, and we encourage the providers to, you know, liberally Xerox them and pass them out to caregivers, attach them to the after visit summaries, etc. Thank you for the opportunity to be with you all, and I look forward to our continued collaboration.